Hello again, Marching Mizzou. In this video, we will discuss emergency interventions. To begin, we will review last video, where we talked about emergency reactions related to sun, heat, and hydration. Following that, we will learn about CPR, the Heimlich Maneuver, concussions, asthma attacks, fainting, seizures, allergic reactions, and EpiPen usage. In the last video, we discussed emergencies related to the sun, heat, and hydration. The two big ones were heat stroke and heat exhaustion. The symptoms of heat stroke are confusion, altered mental status, and slurred speech, as well as loss of consciousness, hot, dry skin or profuse sweating, seizures, and a very high body temperature. Similarly, symptoms of heat exhaustion include headache, nausea, dizziness, weakness, irritability, thirst, heavy sweating, elevated body temperature, and decreased urine put out. If you are concerned about a fellow bandmate having one of these heat-related emergencies, take the following steps to treat them. Call 911 if you need emergency care. Stay with the person until those emergency services arrive. Move the person to a shaded and cool location, and if you can, remove outer clothing. Cool them with water by wetting the skin or placing cool, wet cloths on their skin. If they do have layers that you took off, you can soak that clothing with water. Circulate the air around them to speed the cooling process. And if you're placing wet cloths, put them on the neck, head, groin, or armpits. CPR is an abbreviation standing for cardiopulmonary resuscitation. It is a life-saving action that should take place in an instance where someone's heart stops beating. According to the American Heart Association, immediate CPR can double or triple the chances of survival after a cardiac arrest. The action of CPR keeps blood circulating through the cardiovascular system when the heart is no longer using its automatic action. Manually continuing the beating of one's heart while doing CPR causes a continuation of blood flow that can prevent brain damage as well as damage to the rest of the body and death. Although it is partial, CPR is able to extend the window of time from where a person in cardiac arrest can be successfully resuscitated by emergency response personnel. It is estimated that 350,000 people die of cardiac arrest almost every year. In case of an emergency, you might be unsure if CPR is needed. CPR should be performed when an individual is not breathing. Here are the steps that should be taken. First, make sure your scene is safe. If you have personal protective equipment, wear it. If there's no time to get those, then rush to the person and disregard that first bullet. Check the person for responsiveness. Shout their name, touch their face, do a sternal rub, and have anyone crowding the area stay back and remain calm. Check for breathing and life-threatening bleeding. If they are not breathing, tell someone directly and clearly to call 911 and give someone direction clearly to go and get an AED. Moving your person as little as possible, place them on a stable and firm surface. Kneel down next to them and perform a head tilt chin lift by tilting their head slightly back to open their airway. To maintain the safety of their cervical spine in case of a fall, have a partner hold their head stable, or you can put a rolled up shirt or towel under their neck to maintain that open airway. Do not tilt their head backwards too far or you could close their airway. Begin chest compressions. Compressions should be 2 to 2.5 inches deep and at a rate of 100 to 120 beats per minute. Allow full chest recoil between each compression. Keep your arms stiff and sit up on your knees, keeping your body weight above them and using that to help power your compressions. Repeat the compression cycle and rescue breaths if you have a non-rebreather until an AED or a rescue team arrives. If you have someone with you available who also knows how to do CPR, consider taking turns doing compressions and holding the head in place. This will reduce fatigue and hopefully provide more energized CPR to the person you're trying to save. Do not stop CPR for more than 10 seconds when rotating compressions. When beginning CPR, you want to lace the fingers of your non-dominant hand through the fingers of your dominant hand and place the heel of your palm at the sternum. When compressing the chest, make sure the compressions are 2 inches deep and are at 120 beats per minute. When doing CPR, you also want to make sure that there is full chest relapse, meaning your hands go 2 inches down and come almost off the chest, relieving all chest pressure. Otherwise, there will not be adequate CPR performed. Here is the difference between an open and a closed airway. Notice that when I breathe through this non-rebreather mask, there is no change in the chest. Now, when I tilt the chin back and put a proper seal on the non-rebreather, you can see that the chest rises and falls. Here is another demonstration of improper versus proper technique. In this first demonstration, I do not tilt back the chin and the chest does not move upwards. After I accidentally overextended his neck, I do perform a head tilt chin lift and maintain a proper seal on the non-rebreather mask. When I exhale into the mask, you can see the chest rise and fall, meaning that oxygen is being delivered into the lungs. This device is known as a BVM and can be used to deliver oxygen to the lungs and avoid mouth-to-mouth. Using the BVM, I will demonstrate an improper versus a proper seal. In this first example, I do a head tilt chin lift, but I do not properly secure the mask over the mouth and nose. You will notice that there is no rise and fall in the chest. While here, I perform a proper seal, and you can see that oxygen is being delivered into the lungs by the rise and fall of the chest. Here is a list of the proper steps that you should take in a situation where CPR is necessary. Make sure that your scene is safe. If you have PPE to wear it and put it on as quickly as you can. Check the person for responsiveness. Shout their name, touch their face, rub their sternum. If they do not respond, then it is time to begin CPR. Have anyone crowding the area back away and stay calm. 3. Instruct someone clearly to call 911. 4. Instruct someone clearly to find an AED. This can be done by saying, Dr. Knopps, please call 911. Dr. Zambito, please look for an AED. At this point, you will check again for breathing and begin compressions. As a review, compressions should be 2 to 2.5 inches deep and at a tempo of 100 to 120 beats per minute. Allow full chest recoil between each compression. Keep your arms stiff and sit with your weight up on your knees and keep your weight above your patient and use that power to help you with your compressions. Repeat the compression cycle until an AED or a rescue team arrives. If you have someone available who also knows how to do CPR, consider taking turns doing compressions. This will reduce fatigue and hopefully provide more energized CPR. Do not stop CPR for more than 10 seconds when rotating people giving compressions. The Heimlich Maneuver is the first aid method for choking. Choking is when someone cannot breathe because of an obstruction in the upper airway. Food, a toy, or another small item could be blocking the throat or windpipe. The Heimlich Maneuver can be used on adults and children, but is not recommended for infants. The Heimlich Maneuver is performed by wrapping your arms around a person and making a fist with one hand and clasping it with the other. You place your fists between the person's ribcage and belly button and thrust your hands slightly upward into their abdomen until the object is freed. The Heimlich Maneuver can be a life-saving rescue technique, but should only be used if the person can't breathe and is still conscious. It is also not uncommon to use the 5 and 5 rule, which is to give 5 back blows with the palm of your hand before giving 5 abdominal thrusts. If you are alone and realize that you're choking, do a modification of the Heimlich Maneuver by making a fist and wrapping it with your other hand, placing it in the proper position, and thrusting yourself over the back of a chair to dislodge the item. This should only be done if you are alone or someone you are with is not able to wrap their arms around you. A concussion is a type of traumatic brain injury caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. This sudden movement can cause the brain to bounce or twist inside the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. The most common signs and symptoms of a concussion are one pupil being larger than another, drowsiness or inability to wake up, a headache that gets worse and does not go away, slurred speech, weakness, numbness, or decreased coordination, repeated vomiting or nausea, including convulsions or seizures, unusual behavior, increased confusion, restlessness or agitation, and loss of consciousness. And even a brief loss of consciousness should be taken extremely seriously. If any of these symptoms are to arise in someone that could have been hit in the head, call 911 or take them to an emergency room as fast as you can. An asthma attack is a condition where the airways become swollen and inflamed. The muscles around your airways contract, and the airways produce extra mucus, causing the bronchial tubes to narrow. During an asthma attack, one might cough, wheeze, and have trouble breathing. Symptoms of a minor asthma attack will get better with home treatment. A severe asthma attack that does not improve with home treatment can be a life-threatening emergency. The key to stopping an asthma attack is recognizing and treating a flare-up early. Follow the treatment plan that you worked out with your doctor, and your treatment plan should include what to do when your asthma gets worse and how to deal with an attack in process. Asthma attack signs and symptoms include severe shortness of breath, including chest tightness or pain and coughing or wheezing, low peak expiratory flow readings if you're using a peak flow meter, symptoms that fail to respond to use of a quick-acting or rescue inhaler. These signs and symptoms vary from person to person. If your asthma symptoms do not improve or get worse after you take your medication, you may need emergency treatment. Seek medical attention right away if you have any of the following: severe breathlessness or wheezing at night or in the morning, the inability to speak more than short phrases due to shortness of breath, having to strain your chest muscle or use accessory muscles to breathe, low peak flow readings when using a peak flow meter, and no improvement after using a rescue inhaler. Fainting, or syncope, is a brief episode of unconsciousness caused by a sudden drop in blood pressure. The most likely causes of these sudden drops will either be changes in the blood vessels or changes in the heartbeat itself. Blood vessels continuously adjust their width to ensure a constant and safe blood pressure. For instance, your blood vessels will constrict when you stand up to counteract the effects of gravity. Temporary low blood pressure can be caused by various events that prompt the vessels to dilate, including things like extreme heat, emotional distress, or pain. And any lack of blood flow to the brain can cause a loss of unconsciousness. Most fainting will pass quickly and will not be serious, although any fainting event that does not recover quickly, you should always seek medical attention. The symptoms of a faint include dizziness, lightheadedness, a pale face, perspiration, heightened anxiety and restlessness, and nausea. A temporary drop in blood pressure can be caused by any of the following factors: prolonged standing, especially with locked knees, extreme heat, emotional distress, severe pain, or anything that causes a person to feel distressed, such as the sight of blood, the sight of a needle, or anything else that will cause extreme fear. If you begin to feel faint, especially at band camp, lie down and elevate your feet. This may prevent a loss of consciousness and can also prevent a dangerous fall from taking place. If it is not possible to lie down, put your head as low as possible. And if you do faint, remain lying down for 10 minutes. Make sure your movements are slow and that you sit up slowly when you decide you're able. First aid treatment for a person who has fainted includes helping the person lie down. If they have fainted in a chair, help them onto the ground. If they are already unconscious, roll them on their side, check that they are breathing, and check that they have a pulse. If they are not breathing or do not have a pulse, call 911 and begin CPR as soon as possible. If you are able, elevate the person's feet above their head. If the fainting episode was brought on by heat, remove, loosen, or wet their clothes and try to cool them down by wiping them with a wet cloth or fanning them. Assess the person for any potential injuries if they have fallen. If the person who fainted has not regained consciousness in a couple seconds or do not feel fully recovered a few minutes after their faint, you should call 911. A seizure is a burst of uncontrolled electrical activity between the brain cells that causes temporary abnormalities in muscle tone or movements. It can also affect behaviors, sensations, and a state of someone's awareness. Not all seizures are alike. A seizure can be a single event due to an acute cause, or it can be a recurring problem known as epilepsy. Signs and symptoms of an oncoming seizure can include, but are not limited to, a sudden change in awareness or full loss of consciousness, unusual sensations or thoughts, involuntary twitching or stiffness in the body, or severe stiffening and limb shaking. Signs and symptoms of an oncoming seizure can include, but are not limited to, a sudden change in. The signs and symptoms may vary based on the type of seizure that is being had. They also range from mild to severe, and you should seek immediate medical help if you or someone you see has a seizure and any of the following occur. If the seizure lasts for more than 5 minutes, the person stops breathing after the seizure, a second seizure follows immediately, the seizure is accompanied by a high fever, the seizure is accompanied by heat exhaustion, the person who had the seizure is pregnant, the person who had the seizure is diabetic, or the seizure resulted in an injury. EpiPen is the brand name of auto-injectable devices that delivers the drug epinephrine. It is a life-saving medication used when someone is experiencing a severe allergic reaction known as anaphylaxis. EpiPen is just one of the brand names of devices known generically as epinephrine autoinjectors. This medication acts on the whole body to block the progression of an allergic response. It will constrict your blood vessels, which leads to an increased blood pressure and decreased swelling. This allows the muscles around your airway to relax, causes the lungs to open, and also prevents the release of allergic chemicals, which stops the progression of an allergic response. Epinephrine is the only medication that works on the entire body, multi-system, multi-organ, for anaphylaxis, and this is why it is the only drug recommended. Epinephrine, also known as adrenaline, is both a hormone and a medication. A person's adrenal glands produce epinephrine, which helps to regulate organ functions. It is typically released when your body is under stress, and it is part of the fight or flight response. If something startles you and you feel your pulse race and you feel yourself go pale, that is caused by the release of epinephrine. But like many things in medicine, epinephrine does have other purposes. It is a medication that is the most helpful tool in treating anaphylaxis. Epinephrine has different effects on different parts of the body. The heart will pump faster and harder, and it will raise your blood pressure and circulate quickly through the body. Your lungs and airways will be affected when your breathing becomes deeper and faster. It will dilate the airways and reduce swelling. Your eyes will be dilated in the pupils, your skin will become pale as blood is diverted to your major organs and muscles, and your muscles will have increased blood flow. When an epinephrine injection is given, it does all of this work simultaneously, and it also gives some people the feeling of being hyper or anxious. All of the above are normal and expected effects of epinephrine. In this demonstration I did at the Sinclair School of Nursing, I was given access to a demonstration EpiPen. When you take the EpiPen out of its case, you can see that it has directions written on the back of it for easy injection instructions. Once you pull off the blue tab on the top of the pen, you will inject it into the thigh and hold it for 5 to 10 seconds. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. I hope that this series has been helpful to any band, student, or director that might be watching the series in hopes that they get a better understanding of certain events that might happen on the marching field.